Good morning. My name is State Representative Rebecca Martinez, and I represent Plainville as well as parts of Farmington and Southington. With National Nurses Week, I wanted to make sure that we are standing here and taking time to advocate for an issue that truly impacts our nurses. I've spoken to many of my colleagues, and one thing I hear that is clear, whether it's from nurses that work in hospitals, home care, long-term, is that quite frankly, we are sick of pizza parties and we are ready for some policy.
Yes.
Today, I'm here to draw attention to one of the biggest barriers that's facing the safety for our home healthcare workers. And that barrier is the Medicaid med-administration rate. That's the rate used for billing behavioral health home care safety nursing. Quite frankly, I was appalled when I learned the changes that have been made to this line item over the years. In 2016, this line item was reduced by 15%. And now, every time a nurse goes and sees a patient for behavioral health and med administration, the agency gets paid $53. But it gets worse. They also made a change to align and added what's called subsequent visit rates, which means if a nurse goes and sees two patients that live in the same building, even though the assessment, the work, and the documentation hasn't changed at all, the rate paid to the home care agency is $26. In 2017, they also got rid of an add-on line, and this add-on line made it possible for our behavioral health home care nurses to access things such as translators and escorts. From what I hear, there was a ton of red tape, it was hard to get the reimbursement, but at least at that time it was a possibility. As many of you know, my coworker, Joyce Grayson, was murdered while doing her job by being a visiting care nurse and taking care of her patients. She went into a patient's home and she never made it out. At that time, the legislator jumped into action and worked on SB 1, which would allow for escorts. But with this Medicaid rate so low, how can an agency possibly provide the needed resources for nurses to give the patients the care that they deserve, as well as escorts to keep them safe? It's a slap in the face to stand here and say that I'm not even advocating for stagnant Medicaid rates. I am advocating for Medicaid rates that were drastically cut in 2016. And I am here to encourage our advocates to keep pushing and for our legislators to keep pushing to increase the Medicaid rates to what they need to be. We need to learn from our neighboring states of Massachusetts. Medicaid rates for med administration line is significantly higher already than they were in 16. They do not make any cuts for subsequent visits, and they have an easy process to get a reimbursement when things are needed like escorts. So today I'm here to say, no more pizza parties. Let's get some active policy.